Antisocial personality disorder is estimated to affect between 0.6% to 3.6% of adults and is 3 times more common among men than women. Individuals with an antisocial personality disorder exhibit a lack of guilt, empathy, and remorse and engage in exploitative, aggressive, and deceitful behaviors, often violating the law and disregarding the safety of others. In this video, I will be discussing the need for rehabilitation in reducing criminal recidivism in individuals with ASPD. But first, let us understand criminal recidivism and why it's crucial to rehabilitate these individuals. Criminal recidivism is the act of reoffending, which means committing a crime again after being released from jail. The recidivism rates of individuals with ASPD are very high, so it's really important to teach them prosocial behaviors and help them integrate into society. After thorough research, I came to the conclusion that cognitive behavioral therapy is the most widely used strategy for people with personality disorders. It is a structured treatment which applies cognitive behavioral theory to target the dysfunctional beliefs that underlie aggressive, criminal, or self-damaging behaviors. It helps an individual develop new skills to better manage impulsivity, anger, self-harm, rule-breaking, substance abuse, and negative behavior. It aims to help individuals develop a better understanding of themselves, others, and their difficulties. I used both qualitative and quantitative data for my research. For quantitative data, I conducted 2 online surveys. One was for the general population to understand public opinion, and the second was of individuals in the field of psychology to gain their insights. For qualitative research, I conducted 3 expert interviews. 2 were from clinical psychologists and 1 from a master's student in clinical psychology. The clinical guidelines from the National Institute for Health and Care Excellence state that CBT should be taken into consideration when treating individuals with ASPD. The psychologist interviewed also agreed with this. The study conducted by Daniel Kramer showed that the recidivism risk in their antisocial group had decreased. 36.4% of individuals showed improvement and nearly half remained stable. After thorough research and evaluation, I was able to conclude that CBT is effective and can be used to reduce criminal recidivism. However, some challenges must be overcome for CBT to be effective. Along with addressing these challenges, it is crucial to spread awareness among parents of how ASPD forms in childhood, and early diagnosis and prevention strategies can help reduce the likelihood of ASPD in adulthood. Overall, the clinical psychologist interviewed suggested a multidimensional approach for rehabilitation. There were some limitations in my paper that should be addressed in further research. So, in conclusion, we can say that a multidimensional approach to cognitive behavioral therapy, which is tailored to the needs of each individual, can help in reducing the rates of criminal recidivism in individuals with ASPD and successfully integrate them into society. Thank you.